So, welcome. Welcome to the ERA Journal Club. Each journal club takes place at the last Thursday of the month at 1700 Central European Time, which is 1600 here in Oxford in the UK. Each seminar picks out a topic, a recent original research or key review article from either NDT or CKJ, and the authors introduce their work. And we have at least one expert on the panel, and today is moderated by CKJ Editor-in-Chief, Maria Jose Hostler, and myself, Will Herrington, an Oxford-based nephrologist. Now, today's topic has been highly viewed on the CKJ website. It's about the life-threatening condition of hyponatremia and a particularly interesting hypothesis about Bruce Lee. Now, this is highly topical because it's the 50th anniversary of his death this year, and so many will be remembering his legacy. But one of the questions which remains a mystery about Bruce Lee, apart from the power from his one-inch punch, is really the cause of his death precisely. And we welcome two nephrologists who have a hypothesis, presenters Priscila Villalvazo and Vanessa Perez-Gomez, who co-authored the CKJ editorial comment on this. They're both from the Department of Nephrology and Hypertension at Jimenez Diaz in Madrid. Thank you so much for bringing the glamour of Gong Fu to the ERA Journal Club and sharing your hypothesis. And we're really grateful to Dr. Richard Stern from the University of Rochester and Rochester General Hospital in New York, who is an internationally recognized expert in severe hyponatremia. I don't think he's an international expert in Gong Fu, but you can correct me. And we have Csaba Kovesdy, who is a well-known US-based renal nephrologist who has looked at electrolyte disturbances and a range of other similar risk factors and outcomes. And we really appreciate you both sharing your knowledge today. So we've got a really stimulating topic today. So please do use the Q&A questions so you can get your answers in real time. But I wanted to start off with Priscila asking you what got you interested in this topic.
Yes, good afternoon, everyone. Thank you for the invitation. Yeah, precisely because Bruce Lee as a mystery, fictions, but also for the general people, and that's why we chose it. Like kind of trying to make it more interesting for people to have more interest on their health and the kidney function.
Great. Well, I really look forward to the presentation.
Thank you. So, who was Bruce Lee and who killed Bruce Lee? This was my disclosure of interest. So Bruce Lee was the most influential martial artist of all time. He popularized the philosophical quotes, such as the one starting, "Be water, my friend." And this is what Lee meant with this phrase. So Bruce Lee was American by birth. He was born as Lee Jung-fan in November 27 of 1914 in San Francisco, California. He returned to Hong Kong as a baby and worked as a child actor. And at the age of 13, he began to learn martial arts. At the age of 18, he returned to the United States and studied drama, philosophy, and opened a martial arts school. At the age of 26, he first appeared as a martial arts fighter on American television. He returned to Hong Kong at the age of 29, and he became a writer, director, lead actor, and fight scenes choreographer. Bruce Lee died at the age of 32 in Hong Kong on July 20 in 1973 under mysterious circumstances. As Will mentioned, this year marks the 50th anniversary of his death. And he was producing his last movie, The Game of Death. But who killed Bruce Lee and what is the evidence? We don't have new privileged information. We review the available and publicly information and reinterpret it from the point of view of a nephrologist such as Dr. House. On the day of his death, he was rehearsing some scenes and he drank water. He developed a headache and he took an equagesic pill, which is meprobamate and aspirin. Then he went to bed to rest, and 2 hours later, he was found dead. So Lee died abruptly in 2 hours. There were no signs of physical injury or tongue bite, and severe cerebral edema increased the weight of the brain over than 1.5 kilograms. Traces of marijuana were found in the stomach. The official cause of death was ruled as the result of cerebral edema caused by hypersensitivity to equagesics. However, this cause of death was not widely accepted. Up to now, the cause of death of Bruce Lee is a mystery, is unknown, and we want to know we really killed Bruce Lee. Numerous hypotheses have been proposed since the official cause of death to murder by mafia, family curse, drug abuse, epilepsy, to the latest suggestion in 2018, head stroke. However, there are arguments against this hypothesis. For example, Lee had taken this equagesic in the past. It was not the first time. Then he, on the day of his death, he already felt bad before taking the drug. Regarding the murder, there were no signs of poisoning or physical injury. In a cause of death by cocaine, you will expect the association with cardiovascular comorbidity, and this was not found. While the cannabis were found in the autopsy, we know that this is not a cause of death. Regarding epilepsy, there were a single episode of seizure occurred 2 months early, 2 months before his death. A doctor found a normal neurological evaluation, didn't diagnose epilepsy, but anyway prescribed phenytoin, that is an anti-epileptic drug, and Lee took it until the day of his death, and maybe this will be decrease the risk of further seizures. Regarding head stroke, this was the last suggestion in 2018, but additional to other factors that does not support this theory, you will not expect a death in 2 hours, and even if drank water just minutes before. So let's focus on cerebral edema, since this was the only significant finding at the necropsy. We know that there are 4 principal pathophysiological mechanisms that produce cerebral edema: the pathogenic, cellular, interstitial, and osmotic. In the first 3, we will expect to see other findings at the autopsy. Regarding the osmotic edema, this produces the brain cells swell with water plasma because or due to a osmolarity imbalance, as occurs in hyponatremia. So hyponatremia stands out as a serious possibility and may explain the cerebral edema and the time course of death. Could hyponatremia-induced cerebral edema have killed Bruce Lee? The regulation of water balance is based in the balance between water intake and solid intake, and water loss and solid losses. And this is maintained mainly because thirst and changes in urinary osmolarity. The water homeostasis is regulated by plasma osmolarity that will trigger compensatory mechanisms to maintain the plasma osmolarity, which is driven mainly because sodium plasma concentration, in a very narrow range. When we have increased plasma osmolarity, that is hyponatremia, will trigger thirst and antidiuretic hormone release, and this will lead drinking and a concentrated urine because will decrease the water excretion by the kidneys. And this will restore the homeostasis. In case of decreased plasma osmolarity, which is hyponatremia, and that means excess body water, will suppress the thirst and the ADH release and will produce the kidney a dilute urine because will increase the excretion of water, and this will restore the homeostasis. Therefore, it is unusual to develop hyponatremia or water intoxication unless the rate of water intake is clearly superior of the rate of water excretion, or there are predisposing factors that limit the renal ability to excrete water. When many factors or many predisposing factors are present, the risk of hyponatremia increases. For example, a higher number of drugs that predispose to hyponatremia will increase the risk of hyponatremia. Had Lee factors that predispose to hyponatremia? A brief overview of the available information, public information, suggests that this is the case. Let's see. First, excess water intake. The fact that Lee was drinking water was repeatedly stated will be unusual because it's a common activity. Additionally, we know that marijuana stimulates thirst. On the other hand, low solid intake. In his last month, he appeared to develop a pattern of habits that high fluid intake combined with low solid intake. And we know that this combination decreased the free water excretion capacity. In that, his wife said he had stopped eating solid food and was existing miserably on a carrot and apple juice. Other factor can be alcohol. It appears to be a high ingestion of alcohol. Some claims say that Lee will drink 10 to 20 ceramic bottles of sake in an evening. There are other factors that we found that can impair the capacity of the kidney to respond to ADH. For example, diuretics, because according to public information, Bruce was a frequent use of diuretics, and we know that some diuretics are associated with hyponatremia, for example, that thiazides. Or also, he was taking opioids and anti-epileptic drugs, also associated with hyponatremia. Additionally, the exercise can increase the antidiuretic hormone release. Overall, we had multiple factors that predispose to hyponatremia, impairing the capacity of the body to restore the homeostasis, the water homeostasis. These factors can be chronic intake of water, of liquids, combined with low solid intake, and factors that acutely increase the thirst, and also factors that, for example, can increase the antidiuretic hormone release or can impair the capacity of the kidney to dilute the urine. So there will be a defect in dilution of the urine. So these factors may favorite have hyponatremia, which is water intoxication, which is cerebral edema and death. Lee had a previous cerebral edema episode 2 months before his death, and he had symptoms compatible with hyponatremia, for example, headache, tremor, vomiting, and seizures, and this improved with monitor administration. However, there is no record of the natremia of that episode, as is indicated in this excellent book by Marcos Ocaña. So we propose that excess water intake relative to the kidney capacity to excrete water caused hyponatremia-induced cerebral edema. In other words, we hypothesize that Bruce Lee died from a specific form of kidney dysfunction, the inability to excrete enough water to maintain water homeostasis, which is mainly a tubular function. After following the publication, there was a social media explosion. The report was also mentioned in hundreds of newspapers around the world, on TV and radio. I had to talk with the press, and it was difficult to talking with the press because they were interested in to know about the factor to predispose to hyponatremia. They only had a pervasive question: what is the magic number? How much water you should drink in a day? And I had to say them repeatedly, there is not a magic number that works for everyone. Unfortunately, it coincided with this science publication in November 22, when they talk about the water needs, the water requirements, and they emphasize that water requirements have a large variability according to age, sex, anthropometric, economic, and environmental data. And even they provide a common range and can be from 0.9 to 4.3 liters per day in a different person. So to close, I want to remark that we are proposing that the man who popularized the quote, "Be water, my friend," was killed by water combined with a loss of a key kidney function, but not this kidney function, not glomerular filtration rate that we used to equate to kidney function. Other kidney function, the tubular function, that these are also important, but we don't measure it. The tubers are important not only because they transport a lot of molecules and they restore the homeostasis, but also because they produce other factors such as calcitriol that preserve the bone health, or the anti-aging protein that clotho, which is clotho. So we think that the renal tubers deserve a monument, and we already designed it, and we want to place it at the School of Medicine in the Autonomous University to thanks to the kidney tubers on behalf of the humankind. Can you imagine to build in the pyramids while you have to pee more than 180 liters per day if we didn't have kidney tubers? So I will, the take-home message maybe will be after Priscila presentation, if you are away. Thank you for your attention.
Thank you very much, Vanessa. So when you were researching this, could you tell us what sort of facts you were able to find about Bruce Lee and whether or not I'm sorry, I don't know if he had a post-mortem or not, and what information is available?
No.
Because presumably they did just done a blood test if they and could have ascertained whether or not he had hyponatremia or not.
There are no reports of any of the episodes. The first one is 2 months before, and the day of his death, neither. So, there are no reports.
So I'm just trying to summarize the facts that you have gleaned and whether or not we can find anything which is consistent and inconsistent. So maybe we could start off with the primary cause of death. You mentioned equagesic, which I have not taken myself ever. I've never heard of it before, actually.
Equagesic is aspirin and meprobamate.
Okay, I've heard of aspirin before.
Painkiller.
And a painkiller. Okay.
Yeah.
So he took that as a drug. Did you look to see if that does cause hypersensitivity with specifically cerebral edema type responses? It does seem like a rather extreme response to aspirin.
No, Lee had taken this pill in the past, so this was not the first time. This is the first, and then if it's hypersensibility, you will expect other findings at the necropsy, and they didn't find nothing more, only cerebral edema and marijuana in the stomach. That's it. So it's difficult to think that this is a hypersensibility reaction.
Yeah. Rich, what were your thoughts about? I mean, you're an expert in acute hyponatremia. Were there any features of the description of being able to physically exercise and then having a headache and within 2 hours being dead? Is that could that be consistent with someone who's got severe hyponatremia?
Yes, it is consistent.
Yes, well, thanks. That was just a terrific presentation, and thanks for bringing this topic to the public view. But yeah, the death from hyponatremia occurs very suddenly, and people can go from being just mildly symptomatic to dead literally within minutes. So I think that's quite consistent, as were the many other pieces of evidence. It's hard to imagine another cause for somebody to have 2 episodes of cerebral edema separated by a couple of months, other than hyponatremia.
Yeah, no, so I think you've got 1 vote here. The jury's on your side, Vanessa. I wondered if anyone wanted to comment. So he's a very extreme personality in both his, exercise regimes, but also sounds like his diet, maybe even his drinking and etc. So extreme low solute diets with carrots and apples. Do we think he may have triggered a chronic hyponatremic state, which then just went over the edge one afternoon in the context of some other trigger? Which of his behaviors, I think, his extreme behaviors, do you think might have caused him to have severe hyponatremia?
It's probably the perfect storm, as you have shown a slide where the more risk factors you have, the higher the chances are to develop hyponatremia. And I think sadly what might have worked against him is the fact that he was an extremely fit young man, probably not willing to go and seek medical help for a headache, because we see patients come to the ER with vague symptoms, and then you find out that they are hyponatremic. But if you're into martial arts and you're used to being strong and subdue others, it's quite likely that this manly behavior might have also contributed to his death.
And does marijuana cause hyponatremia? And if so, how? Is mainly through the thirst response? That's a question for anyone.
Yeah. Actually, I can comment on a few things as the only one here who was around at least in the 1970s. And marijuana, obviously, is very common in use, and I don't know of any association, but marijuana now and then often contained other agents. And one of the possibilities that came to my mind in looking at your superb article was whether he might have taken marijuana laced with ecstasy. Ecstasy, marijuana, I didn't know that it provoked thirst. We used to call it the munchies back in the day. But ecstasy definitely makes you want to drink water, and it has the deadly combination of both inducing the release of vasopressin, antidiuretic hormone, and provoking thirst, and the combination of the two can be lethal. And there are many recorded deaths from hyponatremia from ecstasy.
And that's really excellent. So, okay, I think you're convincing the panel, Vanessa. Was there anything out of the history of Bruce Lee which made you second guess your hypothesis? Is there anything which makes you think that there's still a potential alternative explanation, or have all your hypotheses been found to point towards acute severe hyponatremia? Is there something else that you still suspect and would like to rule out?
Now we think that the hyponatremia explains better than other hypotheses the cause of death of Bruce Lee. Now this is what we think. After reviewing, we were really aware when we uncovered all these risk factors, because we didn't expect it, because we was rehearsing, we was preparing a course, a massive online course that we did. We are preparing the second edition, and we found this mystery. And he had a previous episode of cerebral edema. We know that hyponatremia is a cause of cerebral edema. So let's see if we can explain it with this. And then we were really aware to find all these factors. So this was the ring of this mystery for us.
It's very strange that there wasn't a sodium mentioned in the first presentation, or indeed in a post-mortem. That's it. It's such a simple diagnosis to make.
Yeah.
One historical comment again is that in the early 1970s, the awareness in the medical community of hyponatremia as a cause of cerebral edema was not yet there. Alan Arieff's writings and whatnot came after that. The other thing, and then and even now, when many physicians will see a patient with cerebral edema and hyponatremia, they will assume that the hyponatremia is caused by the cerebral edema rather than vice versa. I don't think it would be at all uncommon, particularly in the early 1970s, to just focus on the cerebral edema and consider the hyponatremia a consequence rather than a cause.
Okay, very interesting. Maria Csaba, did you want to ask Vanessa any more questions before? It sounds like we should go and talk a bit more about severe hyponatremia with Priscila. Was there anything else you wanted to ask her?
I want to congratulate them, because I never thought about that when I was young. I was a fan of Bruce Lee. I like this kind of movies, and I never thought about hyponatremia. And after that guy showed this to us, I remember him drinking in the movies.
Yeah,
I remember him drinking in the movies. Yes, he was fighting and drinking at the same time. So maybe this was too much drink. For sure, this was the effect of him. I remember him swearing and drinking. So I don't know. I'm surprised that he didn't eat a lot, because actually marijuana increased your appetite. So I was surprised that it was a kind of control for himself or something like that.
Maybe they get the calories from the alcohol.
That's right. That's right. Could be the point.
Great. Well, a perfect storm of risk factors culminating in a very extreme presentation and death at a young age. Priscila.
Well, dehydration is associated with adverse health outcomes done since a long time ago. We've been told that drinking 2 liters of water daily is good. And why 2 liters? Well, in 1945, the first formal recommendation regarding water intake was made by the U.S. Food and Nutrition Board of the National Research Council, and they established up to 2 liters a day for the average person. Ever since, we've seen in different media these recommendations about the more water, the better. And the recommendation remains almost the same for everybody, meaning that this tall and active young American sportsman should drink the same amount that this small and old Mediterranean granny. And as a consequence, there is a little awareness about the potential dangers of drinking excess water. Excess body water, that is hyponatremia, is common, especially in hospitalized patients, and is associated with increased mortality risk. And additionally, hyponatremia may kill even outside hospital walls, for example, as a consequence of other activities leading to a high water intake in short periods of time, as we can see in all this news. And well, water balance has been in the news recently, reinforcing the message that the more water you drink, the better. That's because a recent observational study that we can see here found that higher serum sodium levels after 12 hours of fast are associated with an increased risk of heart failure after 25 years of follow-up, and previous release emphasized that drinking water will prevent heart failure. But who will be concerned about heart failure and will start drinking water for heart failure? Of course, people with heart failure and their family members. However, hyponatremia is common in heart failure and is associated with adverse outcomes, and hyponatremia means excess of body water. Moreover, the observational association between hyponatremia and future heart failure refer to 12 hours fast, and we all go to sleep and won't drink water during the night. So fasting hyponatremia does not likely identify people who are not drinking enough, but persons that be in excess during the night, and they continue to produce dilute urine despite the lack of water ingestion because their kidneys have lost the ability to concentrate urine. And it is likely that this study identified persons with chronic kidney disease as having a high risk of future heart failure. Indeed, a second manuscript by the same group claimed that fasting hyponatremia was associated with accelerated aging. However, most of the parameters of aging they use are indicative of chronic kidney disease. As you can see here, the glomerular filtration rate, systolic blood pressure, cystatin C. So a more realistic view was provided by this 2022 science paper. They measure water turnover, and water may be either ingested or generated during metabolism. Note that water may be ingested with food, such as fruit, or drunk, and water exits the body in a regulated manner in urine or in an unregulated manner through the skin, lung, and feces. Overall, the science researchers observe mean water turnover.
What are the causes of death when you have people with hyponatremia and heart failure? Are they dying from cardiovascular disease, or is there a component of cerebral disease like Bruce Lee? My assumption was that it was, hyponatremia was very much a marker of severe heart failure, and that they're dying of cardiovascular deaths. Is that what you see in the data? I'm assuming there isn't much cerebral complications from the levels of hyponatremia we normally see.
Obviously, well, you will not get your answers when you look at 1 million patients, but there were studies, or at least one study, where they tried to dig into individual charts of patients with severe hyponatremia, and they didn't die from cerebral edema. So it's a very interesting thing. You have to be very careful what you derive from observational data. Biologically, we know that severe, especially acute hyponatremia, could kill you. But what happens with these large population-based studies that show these extremely robust U-shaped associations? There is a lot of confounding there by the severity of the disease, as you have pointed out. And the final argument, perhaps against this being causative, is what happens when you fix the hyponatremia? Do you improve outcomes? And the clinical trial data, which you could probably comment on mostly, but it's not very compelling.
All right. Well, no, I agree. Death is common, and death from hyponatremia, cerebral edema, is very, very rare. So when you look at associations, death is not a very good outcome to be looking at to understand what's going on with hyponatremia, just because you've got the noise of people dying from other things. And when we looking at charts, medical records of everybody who died at our hospital in over a 12-year period, who had a serum sodium of less than 120. And obviously there were a lot of people who died. We found one death from cerebral edema, and that was a patient with a a stroke who had, had a carotid endarterectomy and was given a thiazide. So I mean, it was like, yeah. So you don't. I don't think that hyponatremia is the immediate cause of death. It may contribute to long-term complications that will increase or decrease your longevity long-term. Perhaps we don't really know.
Okay,
But
so
actually, I'm thinking in dialysis patients that they have sudden death, and we have been for years attributing this to the high potassium levels. But who knows? We do not know when they die at their home. No, after this talk today, who knows? We have been attributing to that, but our patients, for sure, pre-dialysis day, they have hyponatremia because they used to drink and they do not eliminate the fluid intake. So who does not?
They have a lot of peripheral edema in my dialysis unit sometimes as well after the 3-day gap. Maria, Vanessa, you had a comment you wanted to make.
We think that in this article was interesting because they saw that hyponatremia in the morning was associated with more heart failure, no? And they conclude, okay, you have to drink if you don't want to die for cardiovascular disease, no? But we think this is not the point. The point is why these people have hyponatremia in the morning. Maybe because the tubule is not doing a well job. So they have a kidney disease, but the glomerular filtration rate can be good. But what happens with the tubule? This tubule is not working well. Maybe the patient has increased antidiuretic hormone.
Okay, so you're suggesting that hyponatremia in the morning is a marker of tubular dysfunction and associations between risk associations between hyponatremia, with part of the U shape on the other end of the curve we're now talking about hyponatremia, is associated with uncorrected or confounding by unmeasured tubular kidney disease.
We're seeing that. We think that maybe this patient have a chronic kidney disease, but tubular disease that. And for that reason, they have more risk to heart failure and more risk to aging because they already have a kidney disease.
Fine, that sounds very plausible, but difficult to test within large-scale data sets, and not quite sure how you have a big measure of tubular function to adjust for those analyses. Okay, well, Priscila.
So, they found that females should drink around 3 liters, but some of them 3 liters, and not all that amount of water should be ingested only by food, but by the drinkings, but for the foods that they were ingesting. So about the question, how much water should we drink? Maybe we should relax, because honestly, humans have been on the Earth's surface for around 300,000 years, and we have survived without knowing the exact answer to that question. So, and that's because an Asian regulatory system that is the thirst that tell us when we should drink, and combined with ADH secretion at the kidneys will regulate our hydric balance. When thirst or ADH function are disturbed, then we are in trouble. So we should make sure that there is enough understanding of the fact that an adequate hydration state is good, but excessive water intake may be as harmful as dehydration. Not always it is true that the more water, the better. This big American guy may have an American diet, protein-rich, salty, drier foods, providing a high sodium and solute load. And the small granny may have a Mediterranean, fruit-rich, wet diet. Lifestyle beyond salt and water intake are also important for water balance. The granny spends most of her time doing light physical activity. So is she supposed to drink 2 liters? Meanwhile, our big man plays basketball indoors for hours every day, having huge non-regulated water losses through the skin and lungs. And is he supposed to drink 2 liters? And the granny is on thiazides for heart failure and NSAIDs for joint pain and has a low glomerular filtration rate. All of them predisposed to hyponatremia by interfering with urine dilution mechanisms. So is she supposed to drink 2 liters? So in this regard, focusing on the regulated water exit from the body, beware, because that none of us are super peers. We all have pink limits. So a key question is, how much can we pee in a day? People have died because they did not know the answer to this question, and knowing the correct answer may save lives. The peak urine flow rate during water diuresis is about 10 to 15 milliliters per minute, and that extrapolate to 24 hours will be 15 to 22 liters a day. Thus, in the absence of tears, and I emphasize, in the absence of tears, we will be able to pee a maximum excess water intake of up to 800 or 900 milliliters per hour. That is 300 milliliters in 20 minutes. And what if we drink more, like way more? And in a recent example, 6 liters of beer in only 20 minutes, that is 20-fold more water than the kidneys can excrete, as we can see here. Next month, this is the amount of beer a beer drinking champ recently drank before falling asleep and dying of heart attack, or at least that's what the press said. So we made some calculation and estimated a decrease of serum sodium of around 20 millimoles in 80 minutes in what we term hyperacute water loading and acute hyponatremia or HAULA. So why did the beer drinking champ die was a central enigma in our very popular massive online open course or MOOC offered in Spanish in EDX platform focused on kidney functions. And this year we'll be answering the question, who killed Bruce Lee, as the central enigma that illustrates water homeostasis in the novel edition of the EDX UAM MOOC on kidney function.
Society is not aware of the dangers posed by excess water intake. Every year, this results in avoidable death, even in healthy persons, due to hyperacute water loading on an acute hyponatremia, that's HAULA. While the cause of Bruce Lee's death remains unknown, evidence available in the public domain support the concept that he had multiple risk factors for hyponatremia. We propose that hyponatremia resulting from decreased kidney water excretion capacity and excess water intake was the cause of Bruce Lee's cerebral edema and death. Thank you for your attention.
Listening to your theories, it's very difficult to prove anything in retrospect 50 years on. But what I heard from people were there was some convincing, you've convinced some experts, which is fantastic. I didn't realize you were also intrigued into beer drinking and sudden death as well. I always assumed that was acute alcohol toxic. I had never really considered they could induce, with such vast amounts of water, cerebral edema. Are there any other scenarios of very sudden deaths in young people? We've talked about ecstasy, we've talked about beer drinking competitions, we've talked about Bruce Lee in a very extreme exercise diet, and various interesting medications. Are there any other situations you think? What's your next story that you're going to investigate? So one of the things I was thinking about was extreme endurance athletes that suddenly start to, they run for 5-6 hours and suddenly start to veer across the road and collapse, and it's often put down to myocardial infarction or sudden cardiac death. So, thoughts from others? I'm interested in other potential precipitants of it.
It isn't just marathon runners. There is a belief that you have to maintain hydration, and there are recorded deaths among military recruits. And when they start to feel sick, it's assumed it's because they're dehydrated and they're given more water. and deaths from cerebral edema have resulted there. There is among schizophrenics, institutionalized people with schizophrenia, a very high incidence of the extreme water ingestion that you refer to, and it is an important cause of death in those patients as well. And I would finally add that there have been reports now of people getting symptomatic, severe, and occasionally fatal hyponatremia from bowel preps, in which there is a large fluid intake under conditions where you might be nauseated, for example, which provokes vasopressin secretion. I had a colleague a nephrology colleague who lost one of his colleagues to acute hyponatremia related to that, and she didn't die necessarily of cerebral edema and herniation, but rather the cerebral edema caused a seizure and she hit her head and died. So that it is excessive water can be a problem.
And is that in endurance athletes, long distance runners, is it the drinking which you think triggers this in military recruits as well? Is drinking to stay hydrated during exercise and drinking solely water that you think is the trigger? I mean, what about when I was younger? I know I wasn't around when Bruce Lee died. There was a famous advertisement with John Barnes and Lucozade, and it was all about isotonic sports drinks, which started off being isotonic with glucose, which I don't think probably helps at all. But nowadays we talk about people taking, salt with glucose, and that might accelerate the water absorption. But might it be safer because it also encourages salt ingestion at the same time, or should?
There was a rather extensive discussion of this issue in the BMJ a few years ago. The sports drinks industry has done a great deal to try to encourage people to drink lots of fluid for obvious reasons, and we know that people gain weight during a marathon. Some people do, and which means that they're drinking more than they're losing, and is the cause of hyponatremia. The sports drinks contain very little salt, I think that there's been interventions about decreasing the amount of water available during, spacing out the drink stations, et cetera. But it's not what you drink, it's that you're drinking a lot. And regardless of whether it's a sports drink or water, pure water, you can water intoxicate yourself during extreme exercise.
Cool.
I would like to say something. It's important to say that we are not saying that drink water is a bad thing. If you need it, if you are running marathons, you will lose the water because you will sweat, and you will need to restore the homeostasis because you will have thirst and you have to drink if you are thirsty. But so the main message of this presentation is that water needs vary according to each person and circumstances, and that a blanket recommendation of drink 2 liters per day may be dangerous to people with risk factors to hyponatremia. So it's not everybody has to drink 2 liters per day. This is not the magic number for that works for everyone. So each person has a different needs water recommendation per day, and so can vary according to the circumstances.
So Vanessa, you are talking about personalizing the water intake, and yes, how you will propose to do that, because it's easy to talk, but you will propose depending in the body weight and the body surface area. How will you propose? When you have polycystic kidney disease, how will you recommend or propose to do that?
It's difficult. Even this article I mentioned it, they propose a formula that you put all the variables, and the formula gives you one recommendation according to the characteristic of the person, no? But to simplify it, if you after you have to drink, because this is a compensatory mechanism that you have to do it. And if you have some disease like urolithiasis, for example, you will give to the patient instruction that he has to produce a lot of urine per day, but not the amount of water intake. It's the amount of urine that he has to produce in a day to decrease the risk of urolithiasis.
Well, we've actually come to the hour, Richard. So do you want to have a final word?
Yes, I mean, as far as knowing how much water to drink, with the exception of when you're trying to increase urine output because of urolithiasis, we've been endowed with a pretty good mechanism for knowing how much water to drink. And it exists in our hypothalamus, and it tells us that we need water and drink it. And it's called thirst. And we don't need, we don't need P charts or doctor's advice or much of anything other than paying attention to what our osmoregulatory system is telling us what to do.
Great. So listen to your hypothalamus and don't drink, what was it, not 20 pints in 20 minutes when your hypothalamus is not telling you to. I think it's a great message. I hope that maybe someone's listening to this and is going to do an Apple are going to design bioimpedance in their watches so we can have our steps measured each day, and we can also measure our fluid balance as well as our heart rates. But it's a fascinating story. Thank you so much for your help. So on behalf of Maria and myself and the ERA eJournal Club team, so much gratitude to Priscila and Vanessa for your time and your paper, to Csaba and Richard for sharing your expertise and all the knowledge. Please do go to the CKJ website, read the paper. There are other papers in the ERA journals. There's even a clinical practice guideline on diagnosis and treatment of hyponatremia I've just found from 2014.